Okay, so this slide talks about general anesthesia. This is where the nightmare comes in with dealing with small children, okay? One, they're small, they're scared, they're anxious, and then from there, there's also the possibility of the child being allergic to local anesthesia. So we need to check with mommy if there's any allergies that we should be aware of. Sometimes we may have children with severe behavioral problems, them being hyperactive or just scared. And then from there, we then have our disabled children as well as mentally retarded children. So basically with general anesthesia, when it comes to pediatric patients, there's 3 common types of anesthesia that we use. There's local anesthesia if the child, there's topical anesthesia if we don't really require so much anesthesia in a particular area. Ne? Sometimes you'll find that a parent brings in the child has like a mobile tooth, but the tooth is basically flying out of the mouth. So in such instances, you can just apply topical without actually infiltrating or blocking that particular tooth and just extract normally without any incident or anyone crying. Then there's local anesthesia that can be painful. We try and curb that pain by actually applying topical for kids to numb the oral mucosa of that tooth or the tooth of interest. From there, we also then have IV sedation. This is then for our more anxious patients or our more hyperactive or even our disabled children, just to get a bit more cooperation. And then in instances where maybe finances aren't an issue, the child is maybe not so cooperative, or there's a lot of dental procedures that are or have to be done, such as extractions, polishing, pulpotomies, pulpectomies, the whole 9 yards, then such a child will then be placed under general anesthesia, with obviously the accompaniment of an anesthesiologist in theater. So those are the common types of anesthesia that we can produce or perform in South Africa. Okay, so then there's childhood stages, ladies and gentlemen. There's a patient's, okay, I think they made an error here on your slide. They talk about chronological stage. So that's basically, or chronological age, which is the patient's actual age. So if it's now 2020 and the patient was born in 2018, the child is 2 years old. That's the actual birth age. We then have our mental age. So essentially, I could say that's the child's level of intellectual development. I think that's self-explanatory, as well as then the patient's emotional age. So emotional age basically talks about the child's level of emotional maturity. Okay, so you can have instances where a child is 7 years old, my absolute favorites, having the emotional age of someone who's like 10. So that's like a child who you'll explain, like, don't be nervous, this is what's going to happen, don't be scared, and they just sit perfectly throughout the entire appointment because I can say they understand what's happening, or they've understood even the instructions that we as dentists as well as the dental assistant have conveyed or relayed to the child. I think the one thing that they didn't mention in your slide that I also think is important is the patient's dental age. Okay, so that's where I could say the age of the patient dentally. Okay, so the teeth that we expect to have erupted based on a patient's age. So a child, like I'm mentioning, let's say for example now a 9-year-old, the patient could actually chronologically be 9 years old. So if this is 2020, the child was maybe born in 2011, but then the patient's dental age could be about 12 years old. So what does that mean? At 9, we expect maybe your mandibular and your maxillary incisors to have erupted, as well as your lateral incisors to have erupted, as well as maybe having your canines having erupted or are erupting. But now, having classified as this child as a dental age of 12, it would be maybe that not only have the canines erupted, we now have the eruption or teeth or first and second premolars that have already erupted. So basically now they have progressed faster dentally than we would have expected for a child of that particular age. So that's now talking in terms of your chronological age, your mental age, your emotional age, and the one that I've said they did not include that I also think is very important because we're dealing with pediatric patients is the patient's dental age. So we need to classify this our pediatric patient according to all of these different ages, because it does have ramifications on our treatment and the types of procedures that we will perform on such a child. Slide, ladies and gentlemen, talks about the general behavior characteristics of children at various stages. I will not go through it. Very, very, very important. We expect you to know it, be expected to identify it, have a rough idea of a child of a certain age, what type of behavior we will expect, so that you know how to manage this child accordingly when such a child gets to your dental practice. So this slide is very important, ladies and gentlemen. This slide, ladies and gentlemen, talks about some hints or strategies we can impose on children just to handle them better once they actually get to our practices. So the first most common technique will be tell, show, do. So with this technique, the assistant, even the dentist, because we have to work together where kids are involved, we name a dental instrument, we try to demonstrate its use, and then we basically make use of the patient's or even his or her own hands or fingers or the child's ones, just to give an example or show the child how a particular instrument or device actually works. Okay, so once the child is then comfortable, they understand how the instrument or the equipment will be used, we will then proceed to actually make use of said instrument or equipment. So that's essentially what we'll do. So for example, if for polishing the patient's oral cavity, will take their finger, take the polishing brush and actually gently rotate it around the child's finger. Once they feel that it's not painful, then we actually encourage them to open up, and then we actually polish away. But I think the key here, ladies and gentlemen, is also to remember that we have to work very fast on kids because they're very antsy, they're not patient, they don't want to be there. So the moment we get an opportunity to get into that oral cavity or into the patient's mouth, we need to work as fast as humanly possible. Secondly, we need to be on the child's level, so by bending down. So this would then basically be once you actually call the child from the waiting area, our busy, very creative, very bright waiting room, where you actually have to bend down, greet the patient, acknowledge them as our patient for today. Okay, this will also include calling the patient by his or her name, okay, because though they have to be made to feel important so that they can actually be more cooperative once they're actually in the patient in our dental chair. And then we then have to use very tricky or sneaky strategies, such as complimenting the child on his or her clothes or shoes. So if they're wearing like a Batman shirt, you'd be like, "Ooh, nice shirt. Where did you get it from? Oh, are you Batman?" "Yes, I am." And then you just take it from there. Sometimes even complimenting their shoes or nice hair. If we're talking to a little girl, if they came with like a bag, you compliment the bag as well, just to get them distracted and distracted from the procedure itself. Then from there, we must be friendly and praise good behavior. So if they allow us to, for example, polish their teeth, then afterwards we clap hands, yay. We encourage mommy and daddy to clap hands as well, yay. Like everything that they do appropriately or keeping their mouth open, you'll be like, well done, just to keep them feeling happy. And then from there, we try by all means to just ignore bad behavior, because the moment you acknowledge it, they'll actually then persistently do it. Then the appointment will not go anywhere. So just praise good behavior and then ignore bad behavior.